right. Hi, everybody, and welcome. Thanks for having us here today. As Kayla said, I'm Clancy Williams with BlueCross BlueShield, Nebraska. Joining me today is Heather Rollins. Heather Rollins is our manager for under 65 products. So Heather is probably going to chime in every once in a while, especially when I have a question that I can't answer, but I want to make sure you know she's here. So we have about 25 slides and 30 minutes to get through them all. So if you have questions, please let me know. If not, my email address is clancy.williams@nebraskablue.com. Feel free to reach out to me anytime that way as well. So getting started, we just have our legal disclosure that we pop up there. You can read through that, but I want to make sure that that we have legal all situated on this, and then also jumping into here. So with Nebraska ACA enrollments, there's 101,500 enrollees, which was up 3% last year. Successful re-entry into ACA for BlueCross and BlueShield. We had a really good year, so thanks to you guys, we were able to have a good year and keep this product rolling. So on average, you can see there's about 592 new policies per month wrote, and then our top seller was the Bronze Standard Expanded 7500. We have about 4,536 policies sold and growing, so that is the most popular policy. New for next year, so with standard plans, we have a limit issues of quality health plans. So we're going to drop our plans down per metal. We're going to have 2 non-standardized plans and then 1 standard plans per metal. And then also the CSR nudge. If you haven't heard about that, the CSR nudge, that's basically if a customer is on a plan and it's working just as good as maybe a CSR plan, the premium's the same, the deductible's the same. There's about 3 different things that has to qualify it. If so, then it's going to automatically roll into a CSR plan to help those customers save a little more money. Then the consent form. So with the consent form starting June 18th to 2023, there's the new consent form that we all have to have. So the consent you have to have before pulling eligibility, then renew and confirm eligibility applications to be accurate. And then you have to maintain that consent for 10 years. So that is something new that you're going to have to do. Some other new things that we have for BlueCross and BlueShield. So with Heartland Blue, the broker service is going to move to group leaders. So a lot of those questions that you had before, you would have emailed ACA broker service. Now you'll just email group leader, which is groupleader@nebraskablue.com, and they'll help you, which a lot of you are familiar with them. And then we have a dedicated team to over 65 and a dedicated team, to under 65. So like I said, I'm with the under 65, and Heather Rollins is our new manager for under 65. And so we are dedicated to that product and want to make sure that we're the experts in it. We're also going to provide quarterly business reviews. We're going to start rolling those out in the first quarter. So we want to keep you guys all up to date, and we kind of want to keep us transparent as far as what our business looks like, what is growing, and how we're growing the business. Another exciting thing is the electronic ID cards. That's not available just yet. We're hoping to have that done by Q1. There's some more work that has to go into it, but you will be able to download ID cards for your member, which will be a big advantage for you, I believe, coming for 2024. And then renewal reporting. So you're going to have an easy way to report run a report for all your renewals. And then commissions for new and renewing business is going to be beneficial for you as well, which we'll get into. So a few product enhancements. If you look at this, we have urgent care now is going to be considered in network outside of Nebraska. So I think of college students, if they're going to college in Kansas or wherever, they're going to be able to go to urgent care. They'll be considered in network, and then also they'll have telehealth options, be able to call back to the doctor or whatever. So that's kind of a big deal that we didn't have for 2023, but we will have for 2024. And then also we're going to have a member's reward or kind of a healthy reward. The name's kind of drawing me right now, but anyway, so it'll be a way for members to do healthy things, maybe diet, exercise, all that other stuff, and be able to earn points and then turn those points into gift cards. Now we'll talk about our networks. I want to spend a little bit of time with our networks. So with our networks, we're going to keep the same networks that we had. So the Network Blue, the Blueprint Health, and the Premier Select Blue Choice. You can see that the Network Blue is our statewide network. The Blueprint Health, we have CHI, Children's Hospital and Medical Center, Boys Town National Research, and Nebraska Spine Hospital. And then the Premier Select Blue Choice is going to be Nebraska Methodist, Nebraska Medicine, Children's Hospital Medical Center, and then also a Boys Town National Research Hospital and Bryan Health. So we are keeping the same networks. The thing that we are changing is where we're going to have the network. So the area 4, you're going to have the statewide network blue option. And then for areas 1, 2, and 3A, you might remember with 3A, especially if you're in the Kearney, Grand Island, Hastings area, kind of had some pain points there. So with 3A and 1 and 2, you're going to have the option to have network blue. So you're going to have the option to have the statewide network, which will be a big advantage for you. And then also for 3B is going to be the network blue. Now that statewide option network, the network blue for areas 1, 2, and 3, those are going to be for non-standardized plans. So if they're not on a standardized plan and they're in areas 1, 2, and 3, they'll have the option of using the network blue. So discontinued plans. So as I said, we're going from, I believe it was 12 plans down to 9. So what we're going to have to do is we're going to have to map some plans. And so these next few slides, which we'll kind of just go over real quick, are going to change a little bit. So you can see we have the Bronze Zero mental health, the primary care, and the standard plan. Those plans, if you have a member on those plans, are going to go to the Bronze Standard expanded 7,500. So to give you an example of how that works. So this is going to impact less than 1,000 members that we have, but some of them are going to get impacted. So just kind of want to keep you in the loop there. If you have questions about this or you need an accurate or more of a list, let me know. Just email me again. That's clancy.williams@nebraskablue.com, and I'll get you that list. Now, the other thing, we are getting rid of the bronze mental health. We just didn't have a lot of folks use that plan, but we are keeping the silver mental health. So I want to point that out to you. We are making a few changes to it. So you can see your max out of pocket 7,500 and 1,500, and then also for the silver mental health office visit 87, deductible 550 for an individual and 1,100 for a family, and then max out of pocket 3,150 and 6,300 for the family. So again, please reach out to me with questions, concerns, anything that you have. Happy to help you out with that. So now moving on to commissions. So with commissions this year, we're going to have our $20 per member per month again. The thing that we are doing is that's going to work for all renewing business. So anybody that you renew, you'll get $20 per member per month. And anybody new that you sign up, you'll get $20 per member per month. We are going to keep the broker bonus the same. I know there was some confusion last year, so want to spend some time on that. We're going to have 3 different tiers again. So you'll get $25 per member from starting with member 50 up to 149. And then starting at 150 to 249, you'll get $50 per member, and then 250 and beyond will be $125. So this next slide kind of gives us an example of how that works. So if we look at just 100 members at first line, so if you have 100 members, you're going to get your $20 monthly comp, and then the bonus. So starting with member 51, you'll get that times $25. And then you can see your total annual pay there is $25,275. So what I want to make clear on this is if you have over 250 customers signed up, remember it doesn't go back to member number 1. It starts with member 51, and then 51 up to that amount. What was that? 149. You'll get $25, and then starting at 149, you're going to get the $50. And then starting at 250, you'll get the 125. So it goes back to those members. I know that gets a little confusing. Again, if you have questions, comments, please let me know. Also new, the Biden administration for short-term policies have limited us a little bit to that. It's going to be a 3-month short-term policy. So what we're doing, anybody that's on an Armor policy today or signs up before January 1 will have an eligibility or be able to have that policy for a year. So we got a 36-month strategy to grandfather these members in. And what that means is not a 36-month guarantee that they'll have a policy. It means that at the end of the year, we're going to do, they'll go into underwriting like they normally do. And if approved, then they'll go for another year. And then at the end of that year, we'll go through underwriting. If they're approved again, we'll go for another year. Anybody signed up after January 1, the max that we can do is going to be a 3-month policy. So now the other thing that we have is if a member is denied on Armor, so we go back to that same scenario, we go a year, they're denied. Well, now they can go to an off exchange policy. So another way they'll still be able to get a policy through us. Dental Essentials isn't really changing. We are working to get that electronic application done, right, Heather? So we want to get that done as soon as possible. And then also Life Secure and Geo Blue is another offering that we're going to have. So Life Secure is our ancillary products and Geo Blue is our travel benefit. So when we look at those ancillary products, so we have through Life Secure personal accident, critical illness, and hospital indemnity, which is new this year. So that personal accident goes really well with our under 65 policies. And the reason for that is, there's some of those with the high deductibles and whatnot. So you can do a benefit bank at 2,500 up to 15,000. So if we've got a deductible 9,100 and you want to do a $10,000 benefit, you can. And then also you can choose a $0 deductible or a $500 deductible, which I opt to use a $0 deductible. It doesn't cost a lot more and it creates less confusion. And there is an accident death benefit and also guaranteed issue. So anybody can get this policy, which is nice. And you can do it for yourself. You can do it for families. So when you think of that, families that have kids that are active in sports or anybody, I know when we talk about over 65, we talk about other things too, but pickleball is a big deal for under and over 65 folks. And so anybody that gets hurt, whether it's a bee sting, sprained ankle, broken arm, whatever, they go in, to the emergency room, they get that taken care of. You turn in the EOB, or we pay off the EOB, and that's what they're going to get paid. So it's not going to be a guaranteed amount of like $200. It's going to be whatever that EOB says. So there is 24/7 on and off the job coverage. So with that being said, if you're on the job and you break your arm, you're going to get paid your workman's comp. This will also pay on top of that. So there's no coordination of benefits with this. Critical illness. Now that's going to be for folks 18 through 70. There is underwriting with this. So with critical illness, it's going to help cover things as far as cancer, anything that's really critical, basically. So benefit amount 5,000 up to 50,000, $5,000 increments. Coverage, you can get that for the whole family. There is a reoccurring benefit. So if you have cancer and then you get a clean bill of health for a year and it comes back, there is that reoccurring benefit also. There's a return of benefits or premium too benefits. So if you never use the premium or use the benefit and you pass away without using it, that premium will all be refunded too. And then there is a health screening benefit, which will pay a member $50 as well for just doing all their health screening. So the mammograms, colonoscopies, any of those things. Hospital indemnity was changed a little bit. So it's new this year. So eligible ages are going to be 18 through 85. There is a guaranteed issue for 64 and a half up to 66, age 66. And then it's age banded. So meaning that actually all these policies are age banded. So if you sign them up young, that premium is going to stay low for the rest of their life. So, or for as long as they have it. Their daily benefit for hospital indemnity is going to be $100 up to $900 with $10 increments. And you can choose to have that benefit last for 3 days, 6, 10, or 21 days, just depending on what you want to do. Now, that benefit will reset once you're released from the hospital and you've been out of the hospital for 60 days. That benefit will reset. And so you could have that benefit more than once throughout the year, even though you use it all up, you can get it again. So anyway, that's going to be our ancillary products that we can use. And then a few other things. We have some important renewal dates. So with CMS required notice, November 1st, we're going to send out letters and refer these members back, all your members back to the broker. So back to you to assist with renewals, and then update the income, family info, all that stuff. You'll be able to do that. So we're going to send out a notification for that. New for the BBP renewal link. It is going to be easy and convenient. There's going to be a couple clicks and you'll be able to help renew your members. And then, as I said, ID cards. Those are some that you're going to be able to download for yourself too. So as we all know, members, when they're going to the doctor, they forget their card or whatever. Well, we want you to be able to download that, email it to them, text them, whatever that is. Something new that we're going to have on your portal, which I feel is really beneficial. So this is the dashboard. You'll see off to the top right, we have an export detail. So once you click on that export detail, it's going to take you to an Excel sheet, which I apologize, this is blank. But this Excel sheet, you're going to be able to see all your members, and it's going to show active, delinquent, suspended, all that, and you can search it by that too. So another easy way for you to just basically manage your book of business. So that's another feature that we're going to have available for you. I believe it's out there now that you should be able to use. This is a picture of our portal. So once you're in there, you can see, and some of you have seen this already, but you notice we have the bills and notices. So you can see all the invoices going out to your members, any notices. So if the policy was terminated for whatever reason, you can see that the letters were sent. And then all the account information. Now, if you look at that coverage detail tab, that's where you're going to go in and do your renewals. So you'll click on that, and then off to the far right, you'll have another tab that you click on, which will show renewals. So you'll be able to do that right here in our portal. You can help make payments for all the new people you sign up. You can do the binder payments right here, set up auto pay, you can schedule payments, just anything you want to do. So our portal is pretty user friendly. Don't be afraid to get in there if you haven't. If you have gotten in there and have issues with it, please let me know. Again, reach out to me and I'll be happy to help you out. We have a couple of new brochures that you're going to be able to order. So we have our new Heartland brochure coming out. We'll have all the updated information on the networks, policies and all that. The options at a glance is a nice brochure. I like that one. It shows all 3 different metal plans, all the policies, gives you all the information that you're going to need when you are talking to your customer, or hand it out to them. Let them take it home, look at it if they need to, just whatever. So those you can go on our portal under the marketing and be able to download those, or excuse me, able to pick those and get those mailed out to you. So a few things I want you to remember: we have our prospect segment, excuse me, which is included. So all the aged ins, people aging out at 26, 65, all that stuff, uninsured eligibility for subsidies, excuse me, and then employment without coverage or group coverage, and then also family. So as I said before, they're going to get 3 emails. So the first email is going to go out November 6th, then December 1st and December 11th. Then you're going to get some oversized postcards going out November 8th and also November 21st. So with that, I did blow that relatively quick. So if there are questions or comments, please share them now.
We have one question in the chat, and then after I read this one, if anyone else wants to unmute and ask their question of Clancy, please feel free to do that. The question that we have is relation, I think, to the life secure policies, wondering if those can be used as a spend down.
No, they cannot. So sorry, those cannot be used as a spend down.
Does anyone else have any other questions?
Any questions on the networks or how we're doing those, or policies getting mapped over, anything like that?
Clancy, do you want to talk really quick about the average rate increase for 2024?
Oh, yeah, I do. I'm going to refer to Heather a little bit on that one. So there is going to be a rate increase. It's not going to be substantial, but
it's 5.7 on average for our products. So you will have some products that are a little less than, a lot less than 5.7. And you may have some that's more, but overall, all of our products, if you combine everything together, it's on average about 5.7% increase.
Thank you, Heather.
You're welcome.
Sorry for coughing in the middle of that. So yeah, 5.7 increase.
And then we do have another question asking if you could go back and explain the networks and what's available in what parts of the state.
Yeah, I'd be happy to. There we go. So where we're at here in area 1 and 2. So Lincoln is in area 2. So with the network, they're going to have access. You can choose either the Blueprint Health or the Premier Select Blue Choice, or you can choose the statewide Network Blue network. So that's one. And then in Omaha is going to be the same way. You have those 3 different choices to choose from. 3A, again, that's that Kearney, Hastings, Grand Island area. There you're going to have the basically just the Blueprint Health or the Network Blue that you can choose from there. So and then 3B is going to be that Network Blue, and 3 and 4 is going to be Network Blue as well.
And just to clarify, in network or rating area 1 and 2, it is going to be based on what plan they select. So If you have members who like the standardized plans or they like that bronze HSA, if they're in rating area 1 and 2, they will have to select a blueprint option or that premier select blue choice plan. If they're wanting to do a non-standardized plan or any plan except for the bronze HSA, they will have the option to select that network blue option.
Yep, good point. Thanks, Heather.
You're welcome.
Great question. Appreciate that.
Next question we ask if you can talk again about which plans will have the access to urgent care nationwide.
Sure, all plans will have access to urgent care outside of Nebraska. So all plans will.
So not urgent care. If you have a smaller network and you're in the state of Nebraska, how would that urgent care be covered if it's not a part of your smaller network?
Then it'll be out of network then. Is that
Okay.
correct, Heather? So if they're within Nebraska, yeah,
It's the same rules as it was for 2023.
yep, within Nebraska.
Yeah, but adding that as the nationwide benefit is a huge add-on, and it gives people just that peace of mind that when they're traveling or their kids are in school, like you said, so.
I agree with you. Yeah, that's a good thing. So
And last question that we have right now is if you could please review the changes with Armor Health and the new enrollment rules.
yeah, you bet. So that gets a little confusing, I know. So with Armor Health, the new rule is that short-term policies can only be written for 3 months. And so what we're doing for all the grandfathered policies, you can anybody wrote re-signed now, renewed now, or before, or wrote new for January 1, you'll have the option then of having a 36-month window. So that doesn't mean 36 months guarantee you're gonna have a policy. That just means that we can go a year at a time. So we can go year 1. If you're approved, you get a policy again for year 2. If you're approved, then you get a policy again for year 3. So you can be denied in between that. So I hope that clears it up, but yeah, that is a little confusing.
Yeah, and just to add, the law hasn't been finalized just yet. We're expecting it to go into effect as of February or possibly even March. So there's still being discussions had in the government. However, once it does pass, then Clancy, as he mentioned, you can only buy that 90-day policy. So what we're trying to do is anybody who currently has a policy now with us, we will roll out our renewal options by November. And so we will offer that 36-month policy. So if you currently have members who enrolled throughout the whole year of 2023, we're going to offer everybody that 36-month policy where they can start it as of January 1st and pretty much kind of be grandfathered into that option. And so they'll be able to keep it for 36 months as long as they can pass underwriting. We will relook at those policies, like Clancy mentioned, at the 12-month mark. So every January, they'll look at underwriting again. And as long as they can pass, they'll continue to carry that on for up to 36 months.
Thank you.
Will Armor Health have underwriting going forward, assuming the new law passes?
Yes. We're hoping that with the 90-day policy, it'll be a lot easier. Our ultimate goal is to work with underwriting to make that process a lot easier, especially than what it is today. And so there will be some underwriting on those 90-day policies, however, be very simple. We're thinking about, 3 or 4 questions. It's a knockout question. If they mark yes to any of the 4 questions, then they will be denied. But if they mark no to all of those questions, then it's pretty much an automatic approval.
Great. Well, if anybody has any other questions, we'll just give you a moment to ask.
Just one more thing to add on the Armor. We will send out a broker update with more details. We're just finalizing up all of those underwriting requirements and rules. And so once we get that finalized, we'll shoot out a broker update to let everybody know on the new changes.
And then we did have a question if the applications are going to be simplified.
So for the 36-month renewal process, we're just going to currently review them as is, so we won't ask for a new application. But if you do have some new members who want to apply for January 1st to get on that 36-month process, the application will be the same, but we have asked underwriting to ease up on their underwriting requirements, meaning if there's medical records that is needed, we've asked them not to ask for medical records. And so we're hoping that it will improve than what it is today.